At ST plastic surgery, when we perform fat repositioning under the eyes, we also need options to resolve dark circles. Among these, the most crucial one is the Conslet fat graft. It is a technique of layering fat just beneath the skin to brighten the color tone. Normally, if you inject fat into the shallow skin layer, there is a high risk of it forming lumps. To prevent these lumpy and hardened phenomena, we utilize the specially processed Conslet fat graft, and this is the most important factor. True fat repositioning means that rather than simply flattening the area, the deep shadows must be alleviated simultaneously. Now please take a look at this patient. She underwent a simple fat removal, not a repositioning, at another clinic. If you look closely at the left side, you can see a fat graft was also added. This area is slightly bulging and uneven. Because the fat was grafted directly into the muscle layer, the lower section looks unnaturally swollen. They removed the fat, and it seems they tried to inject fat into the hollow tear trough area, but because the ligament wasn't properly released, the fat didn't go into the groove as intended and was pushed upward instead. That is exactly why it is so bumpy, and the fat has hardened into a lump. The previously grafted fat is noticeably bulging right over on this side. It is located right here, this exact bulging section that you see. In short, after the initial fat removal, to cover up the remaining tear trough, a separate fat graft was performed. That grafted fat had become fibrotic, turning uneven and severely calcified over time. For this revision surgery, first we thoroughly release the conjunctiva. Next, we carefully pass the fat through and move it down into the hollowed area. We secure it firmly to the periosteum, but before that, we also partially removed the mass of fibrotic fat that was grafted during her previous surgery. We eliminated the tear trough, removed the calcified grafted fat, and in areas where fat was lacking, we precisely performed a new fat graft directly inside the newly repositioned fat. Even after that, there are still dark circles remaining on the surface skin, right? That is where we layer the Conslet fat. By laying it thinly over the dark circles, we effectively correct the skin's underlying color. And if you look down below, the final result is exactly like this. Let me show you the actual video. This is the direct comparison between before and after the revision surgery. It has been alleviated quite beautifully. The only slight disappointment here is that the previously grafted fat remains very slightly on the left side. But even so, the patient herself was extremely satisfied with the final outcome. Even looking from a 45-degree angle, it looks much cleaner and smoother, doesn't it? The most important thing I want to convey here is, while many clinics cannot perform proper repositioning, you must discard the basic idea that removing the bulging fat equals success. The mindset that the main goal of the surgery is simply to remove the fat bulge should be completely abandoned. Removing the fat bulge is merely the basics. Only by thoroughly resolving the dark circles around the tear trough can you achieve a globally standardized, overwhelmingly satisfying result.